So we'll go ahead and get started. Today we've got Joel Quade here with Aspenwood, who's been an AccuShield customer since 2017. And Joel, I'll have you introduce yourself.
Sure. Joel Quade here. I'm actually the SVP of Operations and Senior Executive Director for the Aspenwood Company. I support a large luxury community in Austin and seven other of our luxury communities, Houston, Charlotte, and Nashville. So we have been partners with AccuShield in all those communities for some time.
Love it. Yeah, and I'm Deontay Davis. I've been with AccuShield for a little over 7 years now. In the beginning, worked mainly with communities, and now for the last couple of years, been overseeing partnerships with our partner agencies. So VP of Partnerships here. Now, who's this for? So conversation today will be centered around care providers. However, same principles apply to any healthcare vendors working in senior living. And at the end of the day, communities want fewer number of companies entering their buildings to help enhance resident safety and security, and ultimately want to retain only the best and most compliant companies. So our goal here, we'd love for you as agencies to walk away with a playbook to help win preferred status and recommended status with these communities. All right, and here we'll talk a little bit about the opportunity. So, today's landscape, here are kind of some of the things that are going on right now and what we're seeing as far as partnerships with communities and agencies. Again, one thing I'll touch on, that third point there, senior living looking to consolidate care to focus on highest quality partnerships. And that second to last point, being on the short list. So for you as agencies, how you can be on that list of recommended providers and get some of those benefits that are mentioned there. So faster referrals, smoother access, and stickier relationships. Joel, anything that you want to add as far as kind of the opportunity in the landscape and also even just how you see things with partnerships with agencies?
I would just add, to your point, the more limited exposure we could have for communities through the various agencies, I think it's a better win for quality, not only just for the volume of people coming in and coming out, but being able to funnel a bit more on what the actual community expectations would be of each given agency. The more you have, the more you've got to manage, and you've got plenty of team members in a community to manage on your own payroll, much less all these agency folks. So I just think it helps streamline the exposure to the community and certainly the quality of care and continuity of care for sure, because you really become in partnership with those agencies and the community team members to manage the greater good for the resident.
Yeah, and that's that point that you mentioned about streamlining. That's really where AccuShield kind of fits into this arena. We want to help streamline those partnerships and provide those partner agencies for these communities to work with, and how to properly vet them. So this is just some data that we've captured from 2 different surveys. On the left, this is a survey that we sent out to our partner communities. We asked how often they're asked by residents or family members to give a recommendation of third-party care companies for any specific needs. So whether it be home health, home care, hospice, 82% said that they are asked for recommendations. And more specifically, 64% said that they are asked monthly. On the right, this is data from a provider survey we offered to our service providers, companies. And we asked, how do you currently attract new business? Some of you may not be shocked by the top answer there, which is word of mouth and client referrals at 89%. Obviously, that's one of the biggest ways new business is garnered. But that one at the bottom, I also want to talk about that and highlight that, which is online advertising. So Google, social media. I think with the amount of people that are doing research on the internet, that'll be one channel that you as partner agencies can really focus on to help strengthen that relationship and also provide a good kind of first impression to communities. And again, landscape-wise, both these surveys show that there is going to be huge opportunity to create stronger partnerships. Now, Joel, I'll let you talk a little bit about this slide here too, but at the end of the day, this is kind of what executive directors and teams at communities care about when they're looking for trusted partners. They have a list of criteria of things that they want to see in their partner agencies. And, yourself as a partner agency, we would say control the controllables, right? These are some of those levers that you can pull to help foster that trusted partnership. Joel, anything that you would add to this?
I would just add that as the community has actually embraced the verify portion, from a community management standpoint, it's a lot easier. Again, if you have a limited number of agency partners that are actively already engaged with AccuShield, because that they understand the process, they understand the HR requirements, the documentation requirements, and are really your firsthand partner to make sure that each caregiver coming into the community privately or through that agency is vetted properly. So becomes a much more arduous task to verify folks and be compliant when it's all those private duty one-off caregivers, which work individually for folks. So having an agency presence and a more conglomerate approach to that makes the compliance level a much more easy lift
Yeah,
ongoing.
it's a good call out. And
So
yeah,
it's a benefit to the community in that regard, as far as having a synergy of agency, one or two solid partners.
yeah, it's a great call out. And so let's talk a little bit about consolidation. So, fewer vendors does not mean less care. It does mean that there are clear standards as well as larger opportunities for those partners who do rise to the occasion. And some of those benefits, to providers, means more predictable volume of work, right? More consistent workflows, and ultimately stronger relationships with that community staff as well as residents. We do also have a poll that's coming. John, if you want to cue that up. There, and that'll be so. What we'd love to hear. What will be your primary focus for growing senior living partnerships in 2026? Looks like we got some results pouring in there. All right, we'll keep it moving. And so here's a little bit of the process of recommendation and kind of what we've seen our community partners do when it comes to this flow. So, a trigger event will happen. So let's call it an injury comes, right? Community is making sure that whatever specific company will be a fit. Part of that is through the provider directory on the AccuShield dashboard. They're making those recommendations to families. Families are selecting who they want to work with, and then monitoring those outcomes for resident well-being based on that care that's provided. And one other thing I'll mention is so on the right, you can see that little image, Google star going up. For providers, what you would really want to focus on is making sure that your profile is complete, most up to date as far as credentials being submitted, and driving to improve those online ratings. In Q1 next year, we are going to be offering a provider rating solution that'll be visible in the directory. So again, going back to that online presence, that is something that will help to foster that trust in those recommendations. Joel, I'd love to hear a little bit from you on kind of some of your experience when it comes to picking agencies to partner with and just some of those conversations that you have with family members on recommending providers.
Sure. Most of our communities, have been opened within the last 10 years or so. So they really intentionally, when they opened, built those partnerships with, typically an agency that can do multifaceted care and that has a Medicare provider number and can do the home health nursing visits and PT, OT, those kind of things, and also has a private duty component. That's the most attractive agency to most of our communities, because that really becomes a one-stop shop to our residents and their family members, rather than having to say, we'll go to A agency for private duty care, and let's go to B agency for PT and OT, and maybe we go to C agency for nursing visits, skilled nursing visits, if those are home health related. So in our book of business, our real win is when we have an agency that's multifaceted and can do the different levels of service and provide the Medicare billing on those things that are appropriate outpatient wise, home health, and then also do the private duty. That's where our real win is in our partners that we pick. As far as the win to the resident and to the community operations for continuity of care.
It's a great takeaway.
And I know in every market that animal doesn't necessarily exist. So sometimes you do have to do a workaround to have a primary or a couple of primary private duty caregiving agencies and then a more home health related um, nursing and therapy partner. But ideally, if it could be in one bucket, it's really helpful and very helpful to the families because we get asked that all the time, and it's an ongoing need. And so, the more directly and efficiently you can direct folks to that, you really ease the burden off of them in a difficult time, typically.
Yeah, and Joel, I know you mentioned a little bit about the region that you oversee. Can you list the states specifically that Aspenwood works in, or where the communities are?
Sure. For the communities I support, we're in Texas, um, North Carolina, and Nashville, Tennessee. The other portfolio of our community, or excuse me, company has presence in Arkansas, Texas, and Arkansas and Texas.
Great. Love it. Texarkana. All right. So now we'll talk a little bit about specific credentials that are required. So each community is able to set what credentials they want to require of their vendors and service providers. What we see standard that most communities decide to check for is criminal background check, company insurance, immunizations. As an agency, you want to make sure that your renewal cadence is pretty spick and span. And Joel, I know that there's some documents that you got, some specific documents you guys also asked for. You want to talk a little bit about that?
Sure. In addition to those, we have an indemnity waiver for the caregiver to sign, just holding the community harmless should they experience an accident while they're with their client at the community. And then we also have a standard of conduct document that delineates, uniform or dress expectations, parking, all those kind of things, so that there's no mystery when a caregiver presents to the community. So those two additional documents are part of our typical package through the verification process.
Great. Yeah, and again, just to reiterate, we work with thousands of communities all across the United States. So different communities will require different documents. And as far as those tips down there, one I'll make a call out on is assigning an internal compliance owner. What we see with our most successful partner agencies is that they have someone dedicated internally who manages the credential process. So uploading those credentials whenever new employees are onboarding, making sure their credentials are in the system so that they could be compliant as they go into buildings. Having one person own that internally, we see that with all our successful partner agencies. And we'll go into a little bit of a case study and example. Joel, this is actually your community, right?
It is.
Yeah. So yeah, process-wise, right, what we're driving at is, consolidation of care, which will lead to better continuity of care and ultimately greater resident well-being. And these are some statistics that we pulled from the actual dashboard as we're collecting visits and seeing what's going on. So care visits were increased by 22%. 10% or more residents were receiving third-party care. 20% less service providers were there per resident. And the biggest one that we want to highlight is the last one. So 24% less companies were providing resident care, right? And so despite an increased need for care this year, Aspenwood's been able to reduce the number of companies serving their residents and the number of service providers per resident. And this is just a little more detail on how these specific care companies had fared. There are 4 winners, 4 losers. We were trying to think of a better word than loser, but that's kind of what we landed on. Before those winners, we saw a 34% increase in the residents served, as well as a 62% increase in care hours. And so those 2 last points as well, 24% less residents were cared for by self-employed providers. Goes back to what Joel mentioned earlier on, really focusing more on agencies to work with, as well as that last point, 8 service providers were flagged for issues on their criminal background checks. So again, we know there are a lot of amazing agencies out there that do a great and thorough job of vetting their people. But, unfortunately, we do catch a lot of these flagged background checks quite a bit. As you can imagine, all the 50 states we work in here at AccuShield. So this is why we do what we do. Joel, anything else that you kind of want to mention around this case study and what we saw at your building?
No, I think, without the verification lens looking into that deeper dive, the exposure is certainly more present.
Yeah, definitely. We'll keep going. So another major point to touch on is creating more tight knit relationships with communities, namely the concierge and the executive director. This will really add a personal touch, make sure that you stand out from other companies and your competitors. A few different ways we could do that. I won't read through all these, but I do want to touch on that first one, which is understanding the culture and processes of the community that you're serving in. Right. Internally, we at AccuShield like to say that every community is like a snowflake. They're all different in their own way. So whatever you can do to abide by their rules, their processes, and play by their game, the better you're going to be in terms of fostering that relationship. Now, family communication. So obviously, we know communication is key. It's one thing to keep communities in the loop, but forging strong relationships with the families is just as critical. So, introducing yourself, making sure you have a cadence of visit summaries, also change of condition alerts, letting these families know when there is a change of condition, and then being available as needed after hours, whatever that may be. These are just some checklist items that we recommend for agencies to complete in the AccuShield dashboard, along with some process improvements you can make as an org that will set you apart from everyone else. Again, not going to read through all these, but one of those that I do want to highlight is keeping your staff roster current. As communities are looking on the AccuShield provider directory, they'll be able to see all those folks that are signing in and out from your agency. So making sure that staff roster is all spick and span will be key as they're looking to forge stronger partnerships. Yeah, we're here to serve communities, residents and providers. So happy to help out in whatever way we can. So please don't hesitate to reach out. And that last point, roster integrations, this will make managing that staff roster a lot easier. So whatever HR platform you use, it's more than likely we probably integrate with them. So if you want to set up those integrations, make sure the data is flowing as seamless as possible, please reach out to us. We'd be happy to set that thing up for you. And I believe John has another poll that will be launching here. So yeah, there it is. If you haven't partnered deeply with senior living, why? And what is keeping you from closer partnerships? And so we've also got a guideline here of what you can do in the first 30, 60, 90 days to cover all your bases and increase your likelihood of becoming a recommended provider. I'll touch on this last one in the 90 days. Don't underestimate the power of an ask, right? Ask to be a recommended provider. Let these communities know that you're abiding by their process, doing that to help foster trust. Now, these are some metrics that can help you move up on that provider directory list that we mentioned. So again, this is available for communities all in their dashboard, which will show them a list of stack ranked agency service provider companies based on a number of different factors. So we would recommend that you focus on these key metrics to help make sure that you move up to the top of that list. Getting your sales and marketing team involved, also very key. AccuShield is not just for credential management and verification, but there are some other aspects that we can help out with for sales and marketing folks at your organization through our platform. We're happy to have those conversations with them. So if you'd like to make an introduction, we'll talk through some of those things that we can do. But ultimately, don't want you all to lose sight of the importance of marketing yourself to the communities and how being a strong verified partner will assist in that. Joel, I know that kind of putting you on the spot here a little bit, but anything that has stood out to you as far as what an agency has done from a sales and marketing perspective to kind of build a relationship with you guys?
I think the most successful agency relationships with the community are just having a really proactive management piece presence at the community. Because the worst thing that can come from a community's relationship with an agency is that the community's having to manage those folks that are coming and going. And very often it's how professional does that person look? How professional does that person appear? It's really rudimentary things these days, but it's the world we live in. People using their cell phones inappropriately and all that. And when that burden falls to the community to manage, it's a real problem for them, and it typically becomes a problem relationship between that community and the agency. So having a proactive, we've had a few agencies even have like a concierge member of their team that goes through the community on daily basis to patrol kind of their own team members that are working there and the interactions therein, and those have been extremely successful additions to their service that have really strengthened that relationship for the long term. So I would just, again, it's just when the community's having to manage the agency, it's a problem.
Yeah. I think one thing I heard there is that you cannot sales and marketing your way out of doing the X's and O's right. So it's the little things. Be on time, show up presentable, all that. Now, going back to this poll here, so 66% don't know who to talk to, 33% low ROI. I think that don't know who to talk to is an interesting answer to get. Now we'll open it up for Q&A. I'm happy to answer any questions that you guys have. I'll give it a minute, see if there's been anything in the chat. Perfect. Rose, I just saw there that you'll reach out to some folks with those specific questions. And so, yeah, we've got 2 QR codes here. So one on the left, if you need help uploading documents, making sure you're abiding by the credential verification process that communities have set forth, feel free to hit that. We're happy to schedule some training with you, walk through how to upload those documents. And on the flip side, on the right, if you have not yet registered for the AccuShield Verified Alliance and want to do so to strengthen those partnerships, you can scan that QR code. Happy to have a conversation and talk through what that would look like. Joel, any closing thoughts or advice that you would want to give to some agencies that are looking to strengthen partnerships with communities?
Don't drop off a bag of candy and a business card and think you're going to get a call back from anybody.
That's a good one. That's
or a coffee cup or a coffee cup full of pens.
Yeah,
those things are long since gone, since we're almost in 2026. But the more personal you can make your efforts and more synergy to the area that you live in, or some kind of synergy to the neighborhood by which the community is serving folks and that kind of thing, the more potentially successful I think that relationship will be.
Love it. Yeah, as my old Texas high school football coach used to say, go the extra mile because no one else is on it. So appreciate you all jumping on the webinar today. Hope you took away some great tips on how you can strengthen some of those partnerships. Again, if there's anything that we can do here at AccuShield to help out, please feel free to reach out to us. As far as if you submitted any questions, myself and the team will follow up with you to answer those specific things you've got. But until next time, Joel, appreciate you taking time to jump on here.
Certainly.
It's a pleasure chatting with you.
Likewise.
Awesome. Thanks, everyone, and hope you have a good rest of the day.